It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Rutherford.
Welcome back. Well, we all love to treat ourselves to a sugary drink every now and then, but it can become problematic to your teeth if you're indulging way too much. Here to show us some recent cases of tooth decay is Dr. Robin Rutherford. Dr. Rutherford, thanks so much for being with us.
Glad to be here.
Okay, so I'm excited about this segment. Almost all of us drink Dr. Pepper, right?
Right. Yeah, and I want to start off by saying I'm really not criticizing Dr. Pepper. I'm going to be talking about how much sugar that's in soft drinks. But Dr. Pepper, Coke, Pepsi, Mountain Dew, what else? Root beer, Big Red, you name them.
Yes.
They're all the same. And surprisingly, in a standard, this is 12-ounce can of soft drink, all these soft drinks are the same. There are 12 teaspoons of sugar in this much. Now, if you had iced tea, you couldn't get 12 teaspoons of sugar to do anything. It would just sit on the bottom, right?
Right.
But somehow, amazingly, they get 12 teaspoons of sugar to dissolve in soft drinks.
Wow.
But, 12, I mean, you wouldn't even drink that if I told you it was in there, but we do all the time. And Dr. Pepper is my favorite too, so I'm not ragging on Dr. Pepper, okay? But this is 12 teaspoons of Dr. Pepper. I was noticing these little guys, instead of 12 ounces with, 10 teaspoons, this is 7.5 ounces, these little guys. And so surprisingly, I read recently that this is the size that soft drinks were back in the 1940s, like the World War II era generation. This was a Coca-Cola. It was these little guys. Our taste for soft drinks has gotten bigger. Nowadays, you don't even think about these except for now lately, they've come out. But this is the standard. Oh, this is the 20 ounce. Wow. I normally don't even do this. I get this. Instead of 10 teaspoons of sugar, there are 17 teaspoons of sugar in this.
Wow.
So what I'm talking about though is that the sugar is really bad for your teeth. Sugar feeds the bacteria, the plaque that's on your teeth. And when plaque gets their favorite food, which is sugar, it cranks out acid. And acid dissolves holes in your teeth, and that's what a cavity is. I want to show you a couple of cases of patients of mine to show you what too much sugar can do to your teeth. This first lady is 31, and she came to me and she knew that she needed a lot of stuff fixed. And she said to me, before I even looked in her mouth, and she says, oh, and I'm a Dr. Pepper girl. And again, I'm not really talking just about Dr. Pepper. That's what she's told to me.
Wow.
And I looked in her mouth, and here's several photos of just her teeth. And the decay, there's a filling there, and the decay has rotted out all around the filling.
Wow.
So it's not fractured, it's not the filling fell out, it's new decay.
Wow.
If you look at the next picture, here's some right along the gum line where there's not even a filling. The next picture even shows worse. There's a silver filling on the near side of the tooth here, and then beyond that though, it's just like rotted out, okay? And that takes a lot of fixing.
Right.
Teeth like this can be beyond fixing even.
Okay.
Because the decay, you just scoop out what ought to be hard. Tooth structure is supposed to be hard, like knocking on wood, and you just scoop it out with a spoon. It's that soft, and that's where decay has just destroyed the tooth structure, okay? Next patient. Now, I'm going to ask you to guess how old this young lady is, but look at her teeth first. She's got one on the upper front that looks like it's sort of broken off almost at the gum line. And look at the big holes. There's another photo here that just shows a little bit of a side angle, but it's the same thing, the same picture, same patient. But with her cavities, they're just all around her mouth. How old would you guess or imagine that this girl could be?
Oh my goodness. I mean, I know the answer.
You know the answer.
Yes, so
14.
it's hard. Yeah.
She is 14. Her big sister came with her to the appointment.
Wow.
She's 14, and literally, I'm telling her that if you don't get on the ball with this, if we don't fix some things, you're going to begin to lose teeth by the time you're 16, for sure.
That is just so young to have teeth like
And
this.
I have known patients, not my patients actually, but people that I have met that moved here from other states or other places that were literally 20, 25 years old that had complete dentures.
Wow.
And I know what happened, just like this. So again, you know, even if I fix every tooth in your mouth, even if I do all the fillings, if we do crowns on everything, some of the stuff I've shown you in other segments, you know, if you don't change the sugar thing, anything I put in there, you can rot out. You can destroy your teeth all over again. There's no way I can make them immune and you can keep drinking. This young girl told me that she drinks 5 to 7 Dr. Peppers a day.
A day.
Yeah. Now that's like smoking. How long does it take to smoke a cigarette? It actually takes a while. Okay. It takes, you don't just drink this and chug it down and go, okay, in 2 hours I'll have another one. No, you sip on it, sip on it, sip on it, sip on it, don't you? You know, with your big gulp and your straw or whatever.
Yes.
And that's the way we really do it in real life. And so actually you're feeding sugar in
Throughout
all
the
day long. Well, every time you take a little drink of sugar, it works on your teeth for about 20 minutes. Well, you know that the next sip is not in 20 minutes, it's sooner than that. So basically you keep the sugar attack going all day long.
Wow.
And that's what she's doing, and this is what her teeth look like.
Wow.
And so, thank goodness, she has come back to me, and we have actually fixed all of this. I didn't know if she could afford crowns or something. Maybe someday that will be needed. But in my judgment, we could fix all of this for now by doing fillings. And in 2 or 3 visits, we have actually done all the fillings on all of her teeth and cleaned her teeth, and you know, everything's in much better shape.
Yeah.
But she's got to stop the sugar thing, right?
Yeah. So it'll just
And
come
that
back.
may be hard.
Yeah.
You know, change to something like water. Ooh, what a concept, you know? And like I say, I like Dr. Pepper, I like Cokes and stuff here too, but not to the point where it does that to your teeth.
Right.
So be aware what your kids are doing, what you're doing to your teeth.
Well, Dr. Rutherford, thank you so much for being with us.
I'm glad to be here.